You completed MD in Agadatantra and you are mainly highlighting the skin disease that is a part of Kajikistan. And what make you think that the Garavishan or the concepts of Agadatantra will help in the treatment of skin diseases?
Actually, I told a little bit about that. For that, I would like to tell how I am actually. There is one quotation in Sushruta sometime, not remember, Prabhashini had a maybe. Yata karas chandana bharavahi bharasya vattanantu chandanasya evamni shastrani bahuni aditya arteshu mudah karavadovati. What he says, a donkey carrying chandana only thinks about the weight of the chandana, not the value of chandana. So likewise, the people who read so many things and if they are not able to apply it, they are foolish people carrying whatever they have learned. So I am of that. Maybe I can consider laziness. I read less, but whatever I read it in such a way that I used to apply it. So for that purpose, when I was doing PG, so I had both options, like exclusively studying in detail about Visha Chikitsa as well as dermatology. But as I told, my way is if you study something, use it. If you are not going to use, I feel why should I waste my time? It's not wasting time, but there is no scope in my area where I decided to practice. So then, as 90% of the patients that used to visit our OPD in Kottakkal used to be of skin disease. So exposure is also high. So I focused more on that and started studying about skin disease only, and that is how it grew. Now, how Garavisha, Dushivisha and all, like I told, Hetulinga Ushadadnana, what is said, Tri Sutra, that is a Shastram, but it's Shashwata. Shashwata, what I mean by that is, as long as any Ayurveda Vaidya practices Ayurveda based on these three principles, Ayurveda will remain Shashwata. It's not like Ayurveda is Shashwata. If we are practicing it in the way it is explained, Tri Sutra Ayurveda, then it is going to be Shashwata. In disease, like in Jwaradikara, whenever there is Vishay Jwara, Abhishanga Jwara and all, there Acharya says Vishajit Chayat. Charaka says, if you do Vishagna Chikitsa, it will be cured. In Shota that is caused by Visha, Acharya says go and refer Visha Chikitsa. Like that, Ashtanga is also there. Means they are telling that if something is caused due to Visha, treat them with Vishagna Chikitsa. When we look into present day diseases, you take any disease, etiologies are almost same, 90% they are the same. The toothpaste that we start our day and maybe the mosquito repellents and all, we end our day with, or even the blanket which comes with so many chemicals, everything is having one or other chemical. And these are low potent poisons, they go on entering into our body and they are called as Dushivisha, which we call Kalantara Prakopi Visham, Dushi Visham, and they stay in our body for long time. You say Kafavatam Varshaganam. So they stay in our body for long time, and when they get to a threshold, they are going to cause strong enough to manifest pathologically, so they will cause the disease. So present day diseases are like that. So I believe that if Viruddhahara is one of the Pradhana etiology, main etiology for skin diseases. Okay, in ancient time, Viruddhahara was the cause, and the Kushta, one particular skin disease was caused. And what Kai Chikitsa line of treatment is there, you apply that and you will get the result. Right? This is what. But Acharyas, what they have said, if the disease is caused due to Visha, so don't just go with the Vishagna, Kai Chikitsa line, you go with Vishagna Chikitsa also. So the present day Viruddhas, even they are not just Viruddhas. For example, you take banana and milk, milk and fruit, they are said to be Viruddhas. The fruits, most of the fruits that we eat on daily basis are made with artificial makers like calcium carbide and all. And the milk, many surveys say that most of the milk in India are either adulterated or there are so many chemicals. When this becomes a Viruddha and it causes disease, at that time, considering it as normal Viruddha may not be the right one. We need to consider Savisha. So at that time we need to treat it, Vishagna Ushadis. The manifestation is the simple example, there is burning sensation. I select medicines from Kai Chikitsa. This is for the Karya. Karya and Karana, two principles I select medicines. So for Karya we select medicines from Kai Chikitsa. Now Karana is Visha. So I need something Vishagna. So I select it from Agadatantra. So this is what I call blending Agadatantra and Kai Chikitsa. And I'm getting very good results with that.